My name is Latoya. I'm 46 years old, and I'm dealing with a large mass in my genital area because of my botched surgery.
She's not kidding.
It's like a big basketball that has grown, and now it's just there, blowing in the wind. Put my clothes on, fold it up, and kind of bring it up here. And then it don't have nowhere else to go, so it falls down.
What is that? So I've got a couple of thoughts here. Obviously, she's a large woman. It's possible that this could be lymphedema. People who have really severe lymphedema can get lymphedema masses in their lower body area. And so that could be a lymphedema mass, essentially. The other thing that this could be, which would be odd that it would be so long and narrow, is a panniculus. A panniculus is basically when you have excess skin and fat from the abdomen that basically sags. The worst case I've ever seen in my practice was a woman who had a panniculus that actually sagged all the way down to her knees.
As far as I can remember, I've always been chubby. And then when I turned 31, I discovered I was pregnant. So they decided to go ahead and do a C-section with me. And then that is when things began to go downhill. When they opened me up to have the C-section, it was discovered that I had 9 hernias, and also part of my bowels had died.
Okay, 9 hernias. I've never heard of somebody having that many hernias. So what exactly is a hernia? A hernia is a hole in the abdominal wall where what's on the inside can essentially pooch out. So you get a hole in the belly button where you can get pooching out and getting essentially an outie belly button. That's a hernia. You can get a hernia in the groin area where the intra-abdominal contents can actually exit through the groin area. Or you can get a ventral hernia, which is a hernia anywhere along the abdominal wall where what's on the inside can pooch out. And then she said that her bowel was dead. That's a huge issue. That's basically dead parts of your intestine, and that can kill you.
Latoya's first surgery will be more my area of expertise, where we'll perform a gastric sleeve, removing almost 2/3 of the stomach.
If you watch My 600-Pound Life, you know what a gastric sleeve is. This is a weight loss operation where a good portion of the stomach is removed, leaving the stomach about the size of a banana. By removing that much of the stomach, the patient is able to eat less food and to feel full much faster. Currently, this is probably the surgery of choice for weight loss because it's less invasive than a gastric bypass operation.
Once she's lost enough weight and she's weight stable, we'll take her back for a second surgery where we take care of the mass and get rid of the extra skin as well.
So the first doctor was a bariatric surgeon, and that's a surgeon that performs the operations to help patients lose the weight. The second doctor appears to be a plastic surgeon, and the plastic surgeon typically deals with the consequences of that weight loss, essentially excess skin. So once she loses the weight, she'll likely have more excess skin develop, and removal of that excess skin with that mass, that hanging stuff that she has, can be done at that time.
Wow.
Oh my God. I can actually see her bowel.
You can see the bowel right here.
Even though they tried to repair my 9 hernias, I did have a recurrence of one.
Right.
There's actually a big loop of intestine that's stuck right here.
You do not see this every day. If you take a look at that part of the video, a screenshot of that, you can actually see the contours of the large intestine sticking out of that hernia. So what's going on here is she has a hole in the abdominal wall, and the actual intestine is protruding out of that abdominal wall and is literally right underneath the skin there. Now, if that intestine gets stuck, then the person can get very, very sick from that and can even kill that intestine off. Now, this is also a very dangerous situation because that intestine is literally right underneath that skin. And if you were to take a pin or a paperclip and poke it, you may actually perforate the intestine, and that is a horrible situation. The intestine can literally pop like a balloon, but what's inside the intestine isn't just air, it's poopy.
What we're trying to do is separate the bowel from the hernia sac. so we can move the bowel back into Latoya's abdomen where it belongs.
So looking at this, it's hard to say whether this is small or large intestine. Now, I did 3 years of general surgery residency, and in general, most of the hernias that I would see that had bowel in them would be the small intestine. But looking at these videos, it's hard for me to tell exactly what part of the intestine is stuck in that hernia sac.
But it is almost never stuck this tightly. Blockage be gone.
This is a very difficult operation to perform because essentially there's a lot of scar tissue around that intestine. You need to cut through and release that scar tissue without tearing the intestine wall. Tearing the wall of the intestine could cause its contents to basically be evacuated from the intestine, and that could obviously create a high risk of infection. So these types of operations need to be performed very, very, very carefully and meticulously.
I'm so excited that Dr. Kundu and I were able to get that bowel out without injuring it and getting it back to where it belongs. Now on to the bariatric procedure.
That's really good news because if they were to have accidentally punctured or torn the bowel, sometimes it cannot be repaired without giving her a temporary colostomy. And if you can avoid that, then you are definitely in a good spot.
It's been almost 9 months since my hernia repair and my gastric bypass. And today is the day I'm finally getting my lymphedema growth removed.
So now we have the answer. It is lymphedema. Lymphedema can have many causes. In third world countries, lymphedema is often caused by parasites, by actual worms that can clog up the lymphatic system. Here in the United States, that's not as common, and the lymphedema that we're seeing with somebody like her often is a result of genetics, cancer treatments, or basically being really, really overweight.
It's right between the lower part of her abdomen and the upper part of her vagina. And then we'll bring the upper part of the vagina right there. So you'll get a bit of a lift today.
Thank you.
So it is kind of in that area of a panniculus, but it's a lymphedema mass. So the panniculus basically is the excess skin that usually lies below the belly button and above the pubic area. And that can lay over the privates. It's the exact same area that this lymphedema mass is, but the lymphedema mass looks like it's more narrow, whereas a panniculus is usually much wider. They are both treated basically the same way by lopping it off and stitching it closed.
Latoya's mass is one of the largest masses I have seen in my practice.
Moment of truth. 9.8 pounds.
In the average tummy tuck that I do in my practice, where we remove excess skin hanging from a tummy, we remove anywhere from 1.5 pounds to maybe 3 pounds of excess skin. This is close to 10 pounds. That patient I told you about earlier in this video with the skin hanging down to her knees, we literally took off 25 pounds off of her. Now that was a panniculus. That was basically skin much wider than this mass that extended all the way down to her knees. This area is much more narrow, and that's why I think it only weighs 10 pounds and not 15, 20, or 25.
The last 3.5 years have been like an absolute nightmare. But the sky's the limit for me now. Without my lymphedema, I can do anything that I want to do now.
Well, she had an amazing result, and kudos to her bariatric surgeon and her plastic surgeon for doing such a great job with her. Well, her lymphedema was quite impressive, but what about a woman who weighs 600 pounds who has probably 5 times as much lymphedema as this person? Take a peek at this video where I react to an episode of My 600-Pound Life, and you are really going to be impressed with how she takes care of a really difficult lymphedema problem. And remember, eat real food, use clean skincare, and auto-rejuvenate before you operate.